Hello everyone, welcome to Logic Medico. Today's interesting topic is intercondylar area of tibia. This is usually a 5-marker question. So this is how you have to approach this question. Intercondylar area of tibia. You have to first draw the upper surface of the tibia. This is the medial condyle of the tibia, slightly larger than the lateral condyle of the tibia. This is the lateral condyle of tibia. So this is how you have to draw the intercondylar area, and you have to label as the medial condyle, and this is the lateral condyle of tibia. So label that as medial and lateral condyle. Upper surface of the, just label it as upper surface of the tibia, right tibia, upper surface of right tibia. After drawing this, then you have to just understand that in the intercondylar area we have the following structures. The medial menisci, I will show the menisci in a different color. So here is a medial menisci. It's large and it is semicircular or semilunar shape. So this is the medial menisci. Whereas the lateral menisci is small and circular. So this is the lateral menisci. So this is the medial menisci on the upper surface of the medial condyle. There will be medial menisci, and this will be the lateral menisci. So once you got hold of that medial and lateral menisci, medial menisci is large and semilunar, lateral menisci is small and circular. Once you got that, you just have to know that the anterior cruciate ligament is attached between the medial and lateral menisci like this. This is the anterior cruciate ligament, whereas the posterior cruciate ligament is the posterior most structure. This is the posterior cruciate ligament, PCL. So posterior cruciate ligament is behind everything, okay, whereas the anterior cruciate ligament is between the medial and lateral menisci. Once you get hold of all these things, you just have to circle that area like this. So this is the intercondylar area of tibia. The intercondylar area of tibia can be explained by simplest mnemonic: Medical College, Lucknow. Lucknow Medical College. Sir, what is this Medical College, Lucknow? Lucknow Medical College. See, this M for medial menisci, L for lateral menisci. We'll finish the M and L first. So M for medial meniscus and L for lateral meniscus. C for the cruciate ligament. But we know that there are two cruciate ligament, okay, the anterior and posterior cruciate ligament. So all that I will do is, I will put a flower bracket for the first three structures, and I will mention as anterior, and I'll put a flower bracket for the next three structures and write posterior. So with this, and of course I have to write the full form in the exam to get 5 marks, okay. So here for simplicity purpose I have just written a short form. So here we have the following things. So here we can clearly see that there is a medial meniscus. This is the anterior portion of the medial meniscus. This one, this area. I'm putting a dot over there, arrow over there. That is the anterior portion of medial meniscus. This is the anterior cruciate ligament, and this is the anterior horn of lateral meniscus. So what is that? Anterior horn of medial meniscus, anterior cruciate ligament, and anterior horn of lateral meniscus. So this is read like this actually. So medial meniscus, which part? Anterior horn. Cruciate ligament, which cruciate ligament? Anterior cruciate ligament. And which part of lateral meniscus? Anterior horn, HORN. So that is the anterior attachments. Moving on to the posterior, we can clearly see immediately after the anterior horn of lateral meniscus, it is a posterior horn of lateral meniscus, posterior horn of medial meniscus, and behind everything is a posterior cruciate ligament. So here we'll see here posterior horn of lateral meniscus. So because this lateral meniscus is, I already told you, it is a circular structure. I'll just show you. So immediately after the anterior horn of lateral meniscus, the posterior horn of lateral meniscus will come. Whereas medial meniscus is a semilunar structure, it will be far away from one another like this. So This is the posterior horn of lateral meniscus, posterior horn of medial meniscus, and of course this is the cruciate ligament. Which cruciate ligament? Posterior cruciate ligament. So the simplest mnemonic is Medical College Lucknow, Lucknow Medical College. If you know on any other medical college other than Lucknow, you can label which is should start from L, then you can take that college. But this is my choice of mnemonic. The easiest way to remember the intercondylar area of tibia. I will tell you in summary, the intercondylar area of tibia is present on the upper surface of the tibia. In this diagram, we have shown the upper surface of right tibia. First, I will draw the medial condyle, which is large, and then I will do the lateral condyle and I will label the condyles. Then I will draw the medial meniscus, which is large and semilunar, and the lateral meniscus, which is small and circular. This is lateral meniscus. And then I will draw the anterior cruciate ligament, which is like kebab mein haddi between the two medial and lateral meniscus. And then I will draw the posterior cruciate ligament, which is behind everything. It's not disturbing anything. Then I will circle that area, or I put a rectangular block like this pink color line. Then I will explain the intercondylar area by the simplest mnemonic: Medical College Lucknow, Lucknow Medical College. So for M I will write medial meniscus, for L I will write lateral meniscus. For C I will write cruciate ligament. After that, first three things I will put a flower bracket and write anterior, and the last three structures I will put a flower bracket and write posterior. While explaining in the exam, I will just write, after this short form I will write what is the full form of this. It is the anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus. Immediately following that will be the posterior horn of lateral meniscus, the posterior horn of medial meniscus, and the posterior cruciate ligament. Then this is the intercondylar area. Meniscus is a white fibrocartilage which is thick in the periphery and thin in the center. Cruciate ligament is a bundle of collagen fiber connecting one bone to the other. Anterior cruciate ligament is taut during extension. Posterior cruciate ligament is taut during flexion of the knee joint. Tear of the ligament is called sprain, and there can be tear of the menisci as well. This is about the intercondylar area of the tibia. Thank you for watching and learning from Logic Medico. If you're new to our channel, kindly consider subscribing to our channel. Don't forget to press the bell icon, and kindly also press the thumbs up icon showing that you like the video, and share this video with your other friends so that others also benefit from it. Thank you once again. Good day.